This is Dr. Caroline Watson and Dr. Rob Weinstock, and we are showcasing MST instruments in our video series. These are complicated cataract surgeries, and we are going to show how we utilized bimanual techniques to get through some of these more challenging situations. So here we can see it's a very white cataract. We use Vision Blue to stain the anterior capsule, and we use our favorite MST microcapsulorhexis forceps to create a quite large capsulorhexis just so we can give ourselves a little more room. As most of you guys know, this has very little cortical material left. It's been liquefied, and so this lens rotates fairly easily in the bag with minimal hydrodissection. We get our Nagahara chopper and our 19 gauge phaco needle with no sleeve, and just very slowly start to sculpt this lens. And just being really careful. You can see that there is some zonular instability. This lens wants to sort of come back with me when I remove the phaco needle from the opposite end. And so I'm just trying to be super careful, very, very slowly sculpting as low as I can get without going through the capsule. And we just kind of create a little groove here, try to give ourselves a little room so that we can divide these two hemis. And we go ahead and very carefully crack the two hemis. I don't like to make sure that the bottom is open just yet, because you can have this dense fibrotic plaque down there, and I've been in a situation where the plaque is sort of adhered to the posterior lens capsule, and you get a nice little pop and things start falling. So I try to be super careful, just try to get that first quadrant cracked. Luckily, it's being cooperative. Put in a little viscoat here. We leave in our irrigating chopper just to give us some control over the eye, and go ahead back in and sort of guide the pieces into the phaco needle, carefully sort of doing a stop and chop technique, moving that nucleus around sort of counterclockwise, just grabbing it and dividing it and just trying to break it up the best that we can, just to give ourselves a little bit less phaco energy in the eye. And, it's actually coming out pretty easily. As you can see, the cortical material is almost completely absent. Just going pretty slowly and pretty deliberately trying to remove each little piece. And then there's this last little piece of cortical material left. Comes out pretty easy. And then we go ahead and insert the lens. And one little piece of nucleus left right there. Make sure that comes out. And we go ahead and do a wound assist technique with the aqueous mixed lens. It's a hydrophilic acrylic lens. Does a wonderful job. We've had a lot of success with it. Our patients really are very happy with their visual outcomes with this lens, and luckily this patient's going to be seeing a lot better after surgery. This is a list of all the instruments that we used, and we appreciate you guys watching, so stay tuned for the next episode.